So that last one that you did, yes, you see that last abortion that you did, it should be your very last. If you have done it once, done it twice, done it, it is no more healthcare. In case you're coming across my videos for the first time, my name is Victoria, and on this channel we talk about everything health and wellness. So if you have not subscribed, please do well to subscribe, and don't forget to watch this video till the end, as I'll be telling you at the end of this video if abortion is healthcare and if it is not, and I'll also explain to you what made it healthcare or what is not making it healthcare. So first of all, I'm going to explain what abortion is before we now enter the complications of abortion. I'm going to be explaining what abortion is and the types of abortion that we have. So first of all, abortion is the termination of pregnancy, and we have two major types of abortion. So the first one is the medical abortion, and the second one is the surgical abortion. The medical abortion is the abortion whereby you use medication like misoprostol to carry out the procedure, while the surgical abortion is the procedure where you go to the hospital and they will use suction machine to remove the stuff from your uterus. These two types of abortion, they are basically the same thing, as they do the same job, right? They are still used to remove a growing fetus from your uterus. So they basically do the same thing. It's just that some people prefer the medication route and some people prefer the evacuation route. So anyone you choose, they basically do the same thing. Before we dive into this video, I want to also state that abortion is actually safe, especially when it is carried out by professionals. However, just like every other medical procedure, it has its own risk and complication, which is what we are going to be discussing in this video. So now we have different complications of abortion. We have different types of complication that comes with abortion. We have the reproductive complications, we have the emotional or psychological complications, then we also have the physical complications. So please do well to subscribe if you have not yet subscribed up until this moment while we go into explaining those complications. In the physical complications of abortion, that is where we have infection. Infection usually occurs when the procedure or the materials that are used during the procedure are not well sterilized, or the environment in which the procedure is being carried out in is not clean and sterile. The next one is uterine perforation. This usually happens with the surgical procedure. That is when the uterus is accidentally punctured. The other one is incomplete abortion. In this incomplete abortion, some of the pregnancy tissues are being retained in the uterus, and most of the times when you have incomplete abortion, it leads to bleeding, cramping, and many other things that will require your doctor to ask you to go in again for the procedure. Next one is cervix or uterine damage. This is the one that is bad, because when the cervix or the uterine lining is being damaged, it can lead to future infertility. The other one is blood clots in the uterus. This one mostly happens with people that have clotting disorder. So when there is a blood clotting in your uterus after the procedure, majority of the times it will cause you cramping and you'll be required to go back to the hospital for medical intervention. Then for the psychological effect, the psychological effect of abortion is something that people usually do not talk about, because most people don't know that there are psychological effects that happen after the procedure, especially with people who never thought that they would do that kind of thing in their whole life, right? So people don't usually talk about it, because even those that are going through that psychological effects, they don't even open up most of the time because they are afraid of being stigmatized and being condemned. So the psychological effects include emotional distress, where one will now start feeling sad, regrets, and the person will now start pushing blames. Maybe the person will now end up pushing the partner for making her do that kind of something, and many more. Anxiety is also one of them. They will now be scared, oh, did anything go wrong? Did anything not go wrong? Will I be able to bear children, or will I not be able to bear children? Some people even enter into depression. So for the reproductive complications, we have future infertility. That is when possibly after maybe you had uterine rupture or you had cervic or uterine damage, it might lead to not being able to like have children in the future. And then there is something that is called ectopic pregnancy, that is pregnancy outside of the uterus. So some complications from abortion actually increases the risk of ectopic pregnancy. Another complication of abortion is death, but then again, death rarely happen when it is under a medical supervision, right? Death usually happens when you don't go to professionals to carry out the procedure. That is when somebody will now have sepsis, somebody will now have hemorrhage, that is heavy bleeding, and they will now die from that. And there are also some factors that can help increase the rate of complications that a person will have after carrying out abortion procedures. Those factors include the gestational age of the pregnancy, that is how long the pregnancy has been. So it is more advisable to carry out the procedure while the pregnancy is still early. Then the second one is the overall health of the individual that is going through the procedure. Some people used to have clotting disorder. Those ones that have clotting disorder, most of the time they end up having complications. And the other factor that can increase your risk of having complications after abortion procedure is the kind of abortion that you are having. Is it medical? Is it surgical? Is it safe or is it unsafe? There are ways that you can actually reduce the complication that comes from having an abortion. The first one is visiting professionals. If you find out that you're pregnant and you do not want to keep that baby, do not go and visit that chemist that is close to your house. Go and seek professional care. The second one is if your pregnancy have advanced, please do not go for those procedures, because the gestational age determines the level of complication that you have after the procedure. So the next one is maintain a good hygiene. You have to clean that place very, very well, and you also have to like start eating well. You eat food that will nourish and replenish your body. Next one is follow the post-procedure care that is given to you. If your doctor tells you that, oh, you should avoid sex, please do avoid sex for that time that he told you to avoid it. If they told you, oh, you should not lift heavy objects, do not lift heavy objects. Follow the instructions as it has been given to you after the procedure. Another one is to seek medical care as soon as possible. If you start noticing any complication, you start noticing that your cramping is lasting longer than it should, you are bleeding longer than you should, or the bleeding is heavier than it should, please seek for medical attention as soon as possible. When should you see your doctor after an abortion procedure? You should see your doctor when the cramping exceeds 3 weeks. When you have been cramping, maybe after the procedure you cramp and it exceeds 2 weeks, getting to 3 weeks, please visit your doctor. Or when your bleeding becomes more heavier, that you have to like change your tampon every 2 hours or every 1 hour, please go see your doctor. Or when your bleeding continues till after 2 weeks, getting to 3 weeks, please go and see your doctor. Or when the psychological effects are coming to you in full force, please go and talk to your doctor. If it's something that needs therapy, he will advise you to go for therapy. So now that we know the complications of abortion, is abortion healthcare or is it not healthcare? Some abortions are healthcare, like those ones that you go to your doctor and they will find out that that pregnancy is putting threat to your life and the life of your baby, and they will ask you to like terminate the pregnancy. That one is healthcare. Abortion that has to do because the mother or the child is not safe is the health care that they are talking about, not that perpetual abortion that you are committing. Yes, that your perpetual abortion is not health care. So that last one that you did, yes, you see that last abortion that you did, it should be your very last. If you have done it once, done it twice, it is no more healthcare. The healthcare is the one that you're advised by your doctor to remove because that pregnancy is putting threat to your life and the life of your baby. Aside from in circumstances like that your perpetual abortion is not healthcare. So thank you so much for watching this video. If you watched up until this moment and you have not subscribed, please do well to subscribe, like this video, share with your friends that you know might need this, And also don't forget to comment, tell me what you want me to film about or the tips you would want me to drop, and also tell me your experience during your last abortion, or tell me the reason why you are so scared of having an abortion. Thank you so much, and I'll see you all in my next one. Bye.